Hello, everyone. I am Deborah Pascali Pinaro of Orgasmic Birth, and I am so honored to have a really special guest today. Dr. Carolyn DeLucia is a board certified OBGYN helping women to regain their feminine empowerment. So, welcome today.
Thank you so much. And I'm very excited to share what my message is with all of you. And thank you all for the beautiful work that you all do for women in the world. And we have to stick together and make this a better world.
Thank you so much. And I couldn't agree with you more, right? We need it in all our lives. And so for us, we've left kind of the sexuality, the pleasure out of childbirth, right? And as a board certified OBGYN, you're really seeing that. So being able to bring that pleasure back in all aspects of life so it can integrate into how people birth and then into that postpartum. So
That's right. Let's get started. All
yeah.
right. I am going to be speaking right from my book, generally speaking, about the revolutionary science of female sexual health. And what I want to bring to the forefront is that intimacy is absolutely integral to every aspect of our life. One of the important aspects as a physician, as a provider, that you want to think about when you approach the intimacy and what to do about the sexual factors and the reasons that people will come to a physician or a provider with this is to think about ethical principles that you must keep in mind. Non-maleficence, doing no harm. We need autonomy of the patient. The patient must be an adult, must be over 18, must have the awareness of the maturity of their body. Beneficence as a provider, do not feel that the patient is in the right place or has to be, perhaps maybe there's been trauma, maybe there's been sexual assault. This must be addressed first before you cause any more emotional trauma. And then there's justice. The physician must feel comfortable with what they are doing and providing for the patient. One of the most important aspects is, do we understand female anatomy? Could you pick your vagina out of a lineup? And if you don't think you can, then you may want to take a better peek at what's going on. So let's get a little bit into female anatomy and important factors that play a role in how we address the issues women encounter. Number one, the absolute closeness of the anatomy. We have the bladder, the anus, and the anus is right after the vagina. There's a small piece of tissue there that's called the perineum, which comes into play. And then the vagina shares a wall with the rectum. Inside, we have the fallopian tube and the ovaries on each side of the uterus, and the uterus with the very tip, the cervix or the mouth of the womb, right at the top of the vagina. With childbirth, there can be looseness of this uterus and it can come down as a prolapse. So the vagina can have looseness from all four sides, as we can all agree, but that has different impact on women. The other important feature I want to bring out is that the clitoris is more than just the little pink tip that we see. Women get erections just like men. Our anatomy in appearance is smaller, but there's a lot more than meets the eye. The vagina is the tube, the conduit from the opening to the mouth of the womb or the cervix. The lower 1/3 is the only area that is rich in nerve endings and sensation. This and musculature for that matter. The rest of the vagina, the upper 2/3, has very few nerve endings, and the course of the vagina has very thin, smooth muscle that we really cannot contract the actual length of the vagina consciously. The G spot. Is there or isn't there a G spot? The evolution of the finding of the G spot, as 1950 was the first time it was described by Dr. Grafenberg, and it is understood today to be a cluster of tissue approximately 1 centimeter to 3 centimeters in from the hymenal ring in the front wall of the vagina, and it is rich in nerve endings, soft tissue, blood vessels, and we believe it could be analogous to the male prostate. This area in women varies in the amount of erogenous sensation. Some people have a very sensitive G spot and some people don't. So when women say, I can't find my G spot, you just it may not be an erogenous zone for you. And that's okay. It doesn't matter. You've got plenty more. The whole body is an erogenous zone. Vaginal changes. The vagina is mainly for procreation. Its primary function is of the female genitalia is to reproduce. There can be decrease in sexual sensation. The mons pubis, which is the fat pad above the pubic bone, increases with fat deposition as time goes by, and the labia majora, the large lips, will deflate and hang. So with that change in fat distribution, a lot of women are self-conscious of the way they are looking externally and become inhibited in the bedroom, want the lights out, that type of thing. There is other, besides physical changes that occur to the clitoris and the G spot as far as arousal and orgasmic function. There, of course, are other factors. There are endocrine, meaning hormones. There's neurological, which can be addressed with the PRP. Psychological, of course, stress, as we know, with COVID being locked in our homes and all of the stress that brought upon psychological effects definitely play a role.